Namaste. Uh, I'm going to discuss over next 20-30 minutes on the way a new ophthalmologist has to tread his path, how to plan himself, how to prepare himself. Let me tell a couple of points that I've understood in my life. I'll share my screen. I've been in ophthalmology since 1975. It's a long time. And I have many of my relatives who are in other specialties of medicine and surgery, but having gone through the entire period, I feel at this point of time as I ever felt that no branch of medicine is as fascinating, as challenging, as charming, as rewarding as ophthalmology. I'm blessed to be here. India is the best place. I've always felt that India is the best place to practice. It's your own hometown, it's your own surroundings, your own people around, and whatever efforts you put in towards the society is helping your own people. So, Make in India is a new challenge, new statement, new slogan that's come up, and that's the thing that we should all understand, appreciate, and work towards. India is not rich all over. There are a lot of people who cannot afford. We all know about it. As long as you're in cities and towns, you'll not realize that, but walk across about 500 miles away from your town into the rural area. Betterment of Indian blinding population with affordable. That's the first word that I would like to use. Give something that's affordable to the community. You may give excellent service, but let it be affordable for them to buy, accountable, and accessible community eye healthcare services. There should be dignity. A person who has availed this affordable service should not feel that he was a burden to somebody else. Equity to all divisions of human beings and excellence, of course, is something which we'll have to always try to achieve. Going back when I was already like all my colleagues, I wanted to go to United States or UK, and I passed my ECFMG, I passed my NIRMP, and I had a post in one of the great universities. But then when I went and talked to my father, he said, "Don't you belong here?" I was the first son in the family, and I went back and realized that I need to stay back. I had an admission in All India Institute of Medical Sciences. I took it up and pursued my career. Recently, last couple of years ago, 2, 3 years ago, we had an alumni meeting, and people from all over the world had come here. And happiest for are those who stayed back in India. Entrepreneurship is something which is talked about throughout. How to be an entrepreneur is it a new word? Entrepreneurship is nothing new for doctors. Doctors have started way back. When I was a child, I've seen my doctor, physician, who started his clinic, who practiced extremely well, who took a lot of risks, mobilized funds, and he burned adrenaline. A patient comes, and it's your responsibility to see that the patient sails through. And the startups are nothing new for a doctor. So doctor himself is a built-in entrepreneur. There's nothing new about it. And the entrepreneur now is related to raising, economy, raising funds. But as an individual, as an entrepreneur, doctors are perfect people right from beginning. Let us go back and see how Lijjat Udyog started by Shri Mahila Griha, a small group of people, 7 women to be precise. They thought they'll make papads at home and sell them. And they started the work. There are two varieties. People who are rich can afford the better variety. People who cannot afford can buy the cheaper variety. So then they came across a person by name Chaganlal Parekh who turned the tables, and he advised to have one quality that should be the best quality. Whatever price you sell, it's your headache, but the quality, there should not be any any shortcuts. So the other thing that he said is, don't run it as a hobby, run it as a full time or a part time, for they're all family women, a, a business enterprise. So run it as a business, though it's something which you're going to help people with parts available at their uh, homes, home doors, and keep proper accounts. This is something which is I would like to stress on. Whatever way you're earning, keep proper accounts. All that the government or the tax people say, you have to keep proper accounts. Pay all taxes that you are. It's not your money. It's the government's money. How they spend is their headache. You have no rights to comment on it, and your job is to share a certain amount of income that you have earned with the government for the government to run and do its work. So 80 rupees loan is what they started with to buy the few condiments and such things. And turnover few years ago is more than 800 crores. So secret of success is run it as a business, keep proper accounts. Every day you have to maintain your accounts, how much you earn, how much you spend. Both are equally important. So you monitor where the money is coming and where the money is going, and pay taxes honestly. To begin with, the whole world, we try to follow what others have accomplished. This person has done that, that person has done this person has done it. The whole world is ahead of you. But then, what are your traits? You may not be fit to follow somebody else's example. So sit down and analyze. Are you very good in surgery? What your person, your friend takes, you know, uh, 1 week to learn, are you learning in 1 day? So you have traits for surgery. Everybody do not have all these traits. And are you good at teaching? Are you good at presentation of your skills? Are you good at research? You have fantastic thoughts which you can feel that they're good for preparing a paper. Are you a good businessman? Are you a good admin? So look at, you may have 2 or 3 traits. It's not easy to have all the traits. Identify them. Public relations is something which is very, very useful. And also think of, when you're a 30-year-old person, what you'll be doing when you're 50 years, when you're 60 years, what you wish to do. Would you would you are you capable of taking a lot of headaches? Would you be doing surgeries plenty beautifully? Would you be managing a big show? Would you be happy with a small, one-man show? So would you like to be an entrepreneur, or would you like to go for employment? Entrepreneurship today is a big challenge. It needs a lot of money, a lot of coordination. You need to take a lot of risks. You need to spend a lot of hours, not only money, but your precious hours has to be spent, and you need to be smart at the end of it. So if you're not there, you should be looking for an employment in a private setup. There are plenty of opportunities, or in a medical college, or as a partner to somebody else. We'll discuss about a little later. And I would like to uh, stress on the fact that you may be capable of doing everything, but then best is to employ people. Labor in India is still very affordable. It's not expensive. But instead of you doing it, let somebody else do it, and avoid doing something which your employee can do. For example, I can collect cash at the end of consultation, but why should I do it? And if there is a cashier who can maintain the accounts, there are a lot of softwares available to issue the receipts, and let her do it. If you want to put drops to the eye, if you want to do refraction, and again, if you want to do a pediatric ophthalmology checkup, have people who can help you out. And trail is something which is extremely important. You need to have targets. Okay, targets need not be big. You don't have to target that you build a big institution. There are two things. Once you have a target in the mind, you need to work towards achieving it. Working towards achieving it means that you'll have to burn adrenaline, you have to burn money. Both you should have in plenty. If you're a very delicate person, not strong at heart, okay, and then what is it supposed to do? And then you'll have to sail along. There are two of varieties. You have a target, work towards achieving it, and sail along whatever it comes to you. So both are equally good. Sailing is just somebody is pushing it and you're sitting on a boat and navigating it. But then you should never be regretting your selections. And Even if you are sailing along the wind or whatever it is, never miss an opportunity. Most of the people, when an opportunity comes, they say, let me think on it, let me work on it, let me come back on it. And my priority is I would like to sail along whatever that comes, so I'll never have a disappointment. If I have a target, I may not achieve it, but then at the end of it, I'll have a disappointment. If I don't have a target, but I'll put in my best efforts to take everything that comes along my trade, so I'll be the happiest person. That's the kind of decisions I took right from beginning. You can excel and achieve, you can put in efforts, you can become very rich and enjoy, and you can scale on politics, you can scale on elections, you can get status, you can positions. These are two three different kinds of hats or caps that you can wear, but you choose which line is your goal. All of them will give you enough money to have a very comfortable life. Never run behind money, never plan to do anything for the sake of money. Money is a small aspect of one's life. Your satisfaction, mental satisfaction, and the way you can achieve something that you would like to achieve is a much bigger satisfaction than money. You'll very soon realize it. And even if you are sailing across or if you have a target, micromanage it. Micromanagement is very good. Delegation is something which you'll give them, but anything you delegate, most of the time it will not be done as perfectly as you would be doing it. Delegation is a second class thing. But even if you delegate, as I said, everything you cannot do, you'll have to delegate works. Then always supervise. The best is to have checklists, weekly checklist, monthly test checklist, and daily checklist, and follow it up. So write down and follow checklist, and write down and follow uh, the plans that you have, and delegated work. Always go back and ask them, have I told, give certain thing, time frame from them, and go back and ask them. If you don't have a habit of asking the progress of your delegation, it is bound to fail. The system will fail. Management of a large organization is always a burden. Always you need a lot of delegation, and you'll have to be happy with 50%, 70%, 80%, or 90% achievement, or 90% success in your delegation, but never be 100. I have had the best of treatment. Bangalore Medical College, the best. All India Institute. I did my MD from there. I went to a rural place in Trichinapalli. Extreme poverty, if you want to see in India, you'll have to work in a rural hospital. I worked there for 1 year. I realized how bad the scenario is. People do not have anything to eat at that point of time. Whenever I did that, maybe things have changed from now, but I was told that poverty is still existing. Saw the poverty live for 1 year there, and I did a fellowship in Shankar Netralaya. I went to America and University of Rochester. I did fellowship in Konya, and beyond this, I visited numerous hundreds of eye centers. Any town I visited, I wish to go and visit the hospital. Every place has something to offer to you to learn. There's no place where you're turned back. Everybody welcomes you. See them functioning. People go to centers and visit doctors just to watch the surgery, how he does surgery. But surgery is only 2 to 3% of what exactly happens in a hospital. Revenue wise, you learn revenue maximum from this, but actually, if you look at the entire thing, actual surgery that's happening for 10 minutes under the microscope is a fraction of what happens in the clinic. So when you go to a hospital, do not focus on watching surgery, focus on what the experience a patient has when he goes around in the hospital. This is the one thing which gives you long-term success. Today is the best time to start to innovate and to grow in India. I came from a phase when electronics and fingertips and the social media and availability of everything on smartphone and computers was not there. We worked hard to gain knowledge. Today, if you want to gain knowledge, it's in your fingertips. It's the best time to start somebody's career. Whatever level you've achieved, the boss is not you, the boss is the patient. This has to be remembered all the time, however great you have grown. And always talk to the patient, looking at his eyes. straightforward. Talk to him extensively. Talk to him about ophthalmology, his findings, his diagnosis, his options that he has, his treatment that you're offering, but also in it something beyond that. If he's coming from some village, ask about the village. So that is the rapport that you're going to build with the patient. And when you talk, be very firm. People are very knowledgeable today. They have symptoms, they have signs, they know the diagnosis, they will check the Google, and they'll come to you. That means that you will have to be extremely knowledgeable, updated in your education, in your experience. And that is the one which brings you confidence. And technology, do not run behind high tech things. You will burn your fingers. Always stay back, years behind the highest technology that's available. Technology is very expensive. Technology means that you'll have to learn your new skills. And technology also means that you'll have to charge extra. And also, it means that your margins are mega, much lesser than what it is. There are, I met in the early phase of my practice one Dr. Krishnan Kutty, hats off to him. He is so passionate about intermediate technology. Intermediate technology is delivering the same results or even better results than highest technology you have by using techniques which are less expensive, which can be created at your own level, which you can manage, which you can serve people with dignity, with elegance, and without losing anything in your practice or in what you give to the patients. So learn high tech. High tech is very important. It will give satisfaction to you in the mind and the heart, but do not be a slave of the machine. Never be a slave of the machine. The results of manual techniques and very high advanced techniques are not different. Not 1% difference is there in the difference. You need to excel whatever you're doing. Learn everything, but do not be slaves to them. The other thing is you will not burn your adrenaline. You will not become senile very soon if you are not tense during your surgery, your procedures, your investigations. I would strictly suggest everybody who does surgery to have recording facilities, excellent recording facilities at very affordable prices available today. That is the only way by uh, improving your technology. Do not think that by doing thousands of surgeries, a lot of people think I have done thousands, I've done 2000s. Thousands, 2000s without any senior watching you. You do surgery, go back and see results tomorrow. Many people don't even see their cases. It's extremely important to go back and see your cases, see how it is. There's a corneal edema in one corner. You have to go back and think on the surgery, what did you do to cause that corneal edema? A continuous feedback should be available from the patient, and go back and see your video as to what exactly produced that. So unless you do, you might have done thousands, but you may be erring every time. Request a master to watch your surgery, to stand next to you. It's not the surgery that you see under microscope. YouTube has got all the videos, but then a surgeon can be very excellent, just because the way he holds instruments, the way he manipulates, the way he moves, the way he understands the pressures inside. There are 101 factors. By watching a 2D video or even a 3D video will not take anywhere. Watch your video, find out the problems that you have had, difficulties you have had, then this go to the video or mail it to some senior colleague and ask him to go through it and give feedback. You will learn surgery extremely faster, and your surgical skills will be much better than you alone learning on your own way, in your own thread, your own path, slowly. That takes years and years. This is a big shortcut. Reviewing of one's own surgical videos. Even now, I come back and watch my surgeries. Every surgery is recorded, and I learn a lot as a feedback at this point of time. About learning, the continuing medical education programs don't bother about which specialty it is. Maybe it's a plasty, maybe it's a retina. Attend all of them. At least one webinar or one live CME should attend in fields that are not foreign to you. That's a foreign to you. Pediatric ophthalmology, strabismus, amblyopia. There are so many subspecialties you'll have to be doing that. Never think that you are a master of anything. You cannot be a master, because as I have seen, every year I change, every 6 months, every 3 months I've changed my technique. And it's today's techniques is always better than what techniques I used to. This thing, internet is the biggest advancement, unlimited. scope for learning is there. This everybody has to exploit. About having branches, some people are very enthusiastic. They start to practice and then they want to have a branch here. Let me have a branch in south of Bangalore, north. I'm from Bangalore, uh, and west of Bangalore. They have two, three, four branches. And every time you are physically not present in an organization, the quality, the care given to the patients is that much lesser. You are lending your name to your branch and you are letting it run the show, and remote management is never as perfect as this thing. One, you're not going to get anything more in life. You need certain returns, and that you'll get from one branch. Be there all the time so patients know that you are there all the time. And I would strictly advise you not to go in for partnership, because except few very isolated examples, all the partnerships have failed. Group practice is excellent. um, 4, 5, 10 people, 20 people. We have a group practice of about 20, 22 people. We could buy much higher value machines, which I don't need in my hospital. And we pool the resources and we pool the expertise, we pool the knowledge. And that's one good way of doing it. And growth, how much you grow, you understand how much everybody grows, but then you have to put a barrier as to this is my limit, understand the boundaries, and stop growing from that point. The tariffs should not be very exorbitant. There are outpatients you run under laws, investigations you run under laws, surgeries you make break even. So then you take the totality, contact lens practice, optical practice. I was the first person who started an optical outlet in an eye clinic, a contact lens outlet in an eye clinic. So it was kept as a taboo before. Then I said, this service is a part of eye care. So I brought it in, and now it's become popular all over the country. And uh, don't discuss about bargains with patients. We have fixed rates which are affordable, and you have 2, 3 rates. Have one rate for people who are economically poor, charitable wing. You may not make any money out of it, but then you will have the numbers there, which will certainly give some satisfaction to you. So, so on these patients, I refine my techniques and I give the best to them, best of the lenses and best of the care to them. And you are gifted to gift site, and that's something which you'll remember all the time. Original research is a very long process. It's a full-time job. It's a job for people who are good at it, and those who are good at it have to join institutions. Otherwise, you'll not be able to do justice to that. And innovation in the clinical skills is a continuous process, and you should be able to do it. Everything need not be published. So there are a lot of avenues today. There are non-period journals, the books, the periodicals are available. You have YouTube now. You can post your surgery, and there are so many ways of sharing your skills and sharing your knowledge today than what it was available in the past. Everybody do not have to publish articles, though it is most of the research is funded by industry. This is one thing which is a negative aspect of it. So nobody can do research on their own unless some funds come. Why do they give funds? If they have a vested interest in a product, they give funds, and that's how the industry grows. That's how the research also is probably biased towards industry rather than our patient care. I'm right to some extent, I may be wrong to some other extent, but then there are always two ways of looking at it. About marketing, I think there is no need for marketing for a good eye care. What is necessary is the patients who come inside, give the best care to them, and the word of mouth is the best way to. You may have a big hoarding. I know you put a big hoarding, nobody walks in. There are so many hoardings as you travel from one place to another place. Do you ever go inside? Banks have got it. Traders have got it. Big holdings. We don't go it unless somebody has told you that this is a good place. They do a good care, and that's how patients have come. Tomorrow you go and find out why patients know about you. Somebody has told them. This is a much better marketing tool rather than spending on advertisements, your TV tutorials, TV advertisements, newspaper advertisements. They all are good. They give value to your name. But ultimately, when the patient walks in, somebody would have told him. That's the importance of word of mouth. Take care of every patient. He'll refer a couple of them. Ambience, it does not have to be a Zaz interiors. I've seen very excellent interiors. Patients have hesitance to come inside. They feel that it's inexpensive. You're paying for the Zaz interiors. That's what the feeling they have. So a clean, even what do you call the subtle large atmosphere is good enough. The patient should be very comfortable, and homely atmosphere is rather appreciated. Comfortable. When you want to buy a row of chairs, sit down for 10 minutes and see if they're comfortable. Comfortable, and the most important thing is the staff who are helpful and smiling. They should go out of the way to help and extend the courtesy and sell your own brands. I'm from Karthik Netralaya. Always tell it's Karthik Netralaya. Nothing else fits in here. I do not take the name of any equipment. I have the best of the equipment, but I do not take the names at all. You get best service, best equipment. And the brand is Karthik Netralaya. So that is how it should come. Like, don't take shelter of an IOL company or a vitrectomy machine company or big international brands. Nobody knows about them. You are trying to push them. So they know about Cadbury, they know about certain things, but medical, we know better than them. So whatever brand you say with the confidence. But the best is tell the features of your machine, tell the features of your lenses, rather than selling another brand under your banner. It's your name, the hospital's name, which should be spelled out, and ask all your staff not to use the name of the brands of products. Talk about your skill, talk about your results. I know a very successful doctor. You are with him for 15 minutes. He would have told you two stories of a patient. That patient came, and I was wondering. I mean, he keeps talking about his patients, his results, and the way he promotes all that is his. He never talks about that. He's a very successful ophthalmologist. And never underestimate Indian products. India is a great country. It has got excellent lenses, excellent machineries. We all use them, but when we talk to the patients, we say an American name, we say European name, a German name, and Japanese name. But try to be no. Some patients say, "I want a foreign." Just two sentences. The Indian are as good as imported one. Will change his mind. So just because you wanted to charge a higher fee for a procedure, do not take the name of an imported one, condemning the Indian products. One thing I would like to tell you is, as the patient, any person walks out of your chamber, your soul should come out and ask you a question: how happy this patient has been with the dialogue that you had with him. This is an important thing. How happy is the patient? What is his assessment about your care? Did you scare him? A lot of people say if you wait for another 1 week, it is a very fashionable approach. If you wait for another 10 days, it's going to burst open. You're going to become blind. You're going to become sick. You will lose the vision. You will die. These are very negative aspects. You don't need to use any of them. When I went to my dentist, he said there is a fungal infection. There is some infection somewhere. I mean, she said she scared me. She asked me to come back for some root canal treatment next day. I just did not go back to that doctor. So scaring is not the way to treat. Explain them terminology. And if somebody wanted to go abroad and they wanted to come back 4 months later for a surgical procedure, this particular friend of mine said, "You cannot go get the surgery and then go and proceed." He had very immature stage of disease. So these are the ones which will bring, and you lose the patients. Always the patient has to leave whatever disease he has with a happy state of mind rather than a sick state of mind. Did you clear all his doubts? All that. So, friends, the way you tread your path has to be planned to some extent, but don't expect the path to be extremely comfortable. Take the path as it comes to you, as it's allocated to you. You do not have to earn all the money in your life. There are so many colleagues. Let them also make their money. I can have my hospital. I could have had 5 branches in Bangalore. I was capable of doing it. But then what happens to the doctors who are practicing in other places? When I was doing eye camps, we've done thousands of eye camps earlier, rural eye camps. We have modernized the eye camps from where it was being practiced. We use microscopes in the camps. We went to Mysore once to do a camp there. One of my senior colleague, he is from All India Institute of Medical Sciences, he called me up that night, "Doctor Ravindra, You come to Mysore to do a camp. This was organized by Lions Club there. Where is the need? We're all here to take care of patients, rich or poor. I mean, that was the beginning of my career. And from that day onwards, we never did an eye camp in a town where facilities are already available. It's not necessary. Where is the need to do an eye camp in Bangalore? There are hundreds of going on. There are hundreds of free eye camps going for IT technology people. Where is the need? They all have so much of money. They are all covered by insurance. They can take care. It's the funniest thing is our own people will go and do an eye camp in industries. In nothing happens there. You don't even diagnose diseases properly. So we had to think a lot before delivering what we plan to do. And as I said, youngsters should always learn in a proper way. There are 1,000 ways to learn, and always plan their career based upon what they wish to do when they are 60-year-old. Thank you. Have a nice day.